TLC Real Talk. It's our very first one. I am so blessed to be a presenter on the radio, Love Radio. I'm on a Thursday, and you can catch me every Sunday morning on Kids Connect. So this is our very first, like I said, Real Talk. Tonight we are going to talk about something that is obviously in the news, across the globe, affecting lives daily, affecting families, incomes, schools. We want to talk about COVID-19. We want to discuss between us and yourself how it's affected certain people, how it's affecting you, how it's affecting your household. So with me tonight are very special people. 4 very special people. There's Tracy Boschard. She is a COVID survivor. She's going to tell us her story. She was almost, one could say, asymptomatic, but I'm going to leave it for her to tell you. She's a mom of 2 wonderful girls, and she is got an interesting story. She's busy immigrating at the moment. So during this pandemic, God still really moves and honestly works in mysterious ways. Then the only gentleman with us tonight is Oppa Litsoane. He is a father of 2. He is another wonderful COVID survivor. He's going to tell us his story. He's going to tell us his testimony. He's going to tell us what word he stood on and how all of this affected him, how this made him more of a warrior. He's going to share his remedies with us. And yeah, we look forward to hearing your story, Oppa. And then I've got the wonderful Chrismari Herholdt with us. She is a clinical psychologist. She spends her days helping people in hospitals. She is the clinical psychologist in one of the biggest hospitals in South Africa. She, I promise you, has helped so many people through a rough time and is helping people daily, patients and staff, to get through this period. And she's going to give us some of her expertise. And last but not least is the amazing Dr.Elrike Van Der Merwe. She's the beautiful lady with the cat. She is so smart. She's a clinical manager in one of the biggest hospitals in South Africa. And Dr. Elrike, if that is not enough, you are studying your MBA. So we are looking forward to hearing from you, having you debunk a few myths for us, debunk a few of my myths, and just basically giving us, the rundown of what we need to look out for, what is out there. And yeah, this is going to be incredible. Our very first TLC Real Talk. And then the other thing I'd like to please encourage you to do is please share, like this, start a watch party, guys, and also send through any questions so that I can answer them, field them through to Oppa, to Tracy, to Elrike, to Chrismari, so that we can also help you have peace of mind during this time. Okay, so let's go ahead. Okay, so let me chat to Oppa and Tracy and ask you, how did you know you were sick, Oppa? What made you think that there was something wrong?
With me, I didn't know. I knew that I was sick, but I didn't know that I had COVID-19. I remember it was around the 3rd of June, and I was due to take my daughter back to school to Pretoria. And that week I had some slight cough and then, a little bit of fever and a little bit of tiredness, and which I never really took very serious. But on my traveling from Cape Town, I decided that I had to drive because, you know, the flights already, it was a time when the president had just actually put lockdown 3 rules. And it was actually risky for me to fly my daughter back to school. So I decided to drive with my wife.
Oh, my
And
word. Okay.
as we were driving, because of the long distance, I got more and more feeling more sickly and feeling, I think we were somewhere just in Northern Cape, just after passing Colesberg, where I felt that my knees were kind of getting weak and
Oh,
I
my
felt
word.
pain and I felt pain, but I didn't know what the problem was. So we drove up and back, and on Monday, which was I think around the 7th, that's when I managed to go and see the doctor.
Okay.
My GP. So seeing my GP, and I'm also diabetic.
Oh.
So, yes, that was the other issue with me. I'm diabetic. I've been a type 2 since I think for more than 10 years now. And my GP found that immediately when he tested. The first thing that he started with was he said, let's check that sugar level first, and it was around 21 millimole. And he decided to go straight to the doctor to see another doctor at the hospital, because at that time I was now coughing, and it was basically a dry cough. And I had a pain also on my chest, on my right hand side. It was like a pain on my right lung or something like that at the bottom. So that actually made him to say, go straight to Milnerton Clinic at the respiratory department, where they were dealing with the COVID-19 cases for tests. So I went there for those two things, and to make sure that my sugar levels is actually lowered and I can be tested for COVID-19.
Okay.
So I was tested, yes.
Yeah.
So I was tested on that day. And
Yeah.
after being tested that day, and then I had to wait for the results, which came on Thursday.
Okay. Tracy, how did you know that you were sick?
Apologies. Well, at the time I was working in a hospital, and obviously COVID is on your mind 24/7. And I started having minor symptoms, but symptoms that I wasn't used to getting. I had headaches with very slight nausea, and I was very, very tired. The one day I wanted to sleep by my desk, basically, and I thought, okay, something's not right. I had a little bit of body ache, but it just didn't feel right, and I'm very much in tune with my body. I do suffer from migraines, but this was a different headache. And I asked some of the doctors at the hospital, shouldn't I have a test? Headaches aren't the first thing that is asked when you are being screened for COVID. But I just decided I want to make sure everyone else is safe, and that I'm going to go for the test. So I went for the test, and that was on a Wednesday at 4 o'clock, and the following morning at 8 o'clock I had the results.
That was quick.
That was
Dr. Sorry, I just want to find out from you, what tests do they do? Is there a nasal, a throat? What do we look out for? Because there was this, what do they call it, case definition, but are we sticking to that now?
Yeah, the case definition has changed a few times over the past few months as new information sort of gets available. So at the moment, the only test that's really accepted is what we call the PCR, and that is where they basically grow the virus, so let the virus multiply in the lab, so they can actually look for it. So we don't do antibodies tests or anything like that. So there's two swabs that they can do. The one is the nasopharyngeal, so that means you go through the nose right at the back of your throat, that is your nasopharynx, or yet they do an oropharyngeal, that is your where you go through the mouth basically, and they want to go deep. They want to actually almost touch your tonsils, because that is where the virus actually replicates in your airway. So that is where, if you have it, your highest concentration of virus particles will be.
Okay.
You have a better chance of actually not getting a false negative, for example.
Okay. Chrismari, what are the kind of emotions that people go through when they go for a test like this? Like, you know, it's a bit daunting, you nervy, and you
Yes.
wait long.
Yeah, depends on where you go testing. I think the people that's fortunate enough to have medical aid or financial stability can go for the pathway tests, but still people are very anxious. They don't know how it's going to be done. Sometimes it changes, even though a friend tells you it's in the throat. When you go, it's through the nose. So there's a lot of anxiety, and then specifically the waiting time for people is very scary, to wait and to isolate themselves until they get the results. I find a lot of the patients say that's for them the worst time, to not know. The unknown is anxiety provoking.
Yeah. So Oppa and Tracy, or Oppa first, what did you do when you found out that you had COVID? And you know, you're a dad, you've got a family. How did you handle it?
Firstly, the advantage that I had over my illness was that I'm a professional nurse. I'm a trained professional nurse, yes. I worked as a nurse for quite a number of years, even though that I haven't been practicing for more than 20 years now. Of course, I went into business. But my knowledge about health has always been there on basically how to improve my immune system and how to deal with minor ailments. So I basically resorted to that. But before I got sick, I had already been studying a lot about COVID-19, and there were a lot of videos on YouTube also, which I managed to get information from, and others were being sent around. So, and in our family, we have a group where we communicate about the different illnesses and whatever, how one can treat and all that.
Oh.
And my elder brother sent one of the videos of one of the doctors, Dr. Alan Mendel.
Yes.
Where he gave a concoction of basically how to improve the immune system, specifically during this time of COVID-19. So I went into YouTube and then checked to confirm that really this thing is real. And I think that's where things actually started. And then I started researching more about other things. And the one other video that I got also about was a story about the onions, which shocked me because I never really thought onions could be so good for health. I just knew them that they were being used by people, some people actually, when there's a smell of fresh paint.
Yes.
Yes, if you use that onion and put it in that area that has just recently been painted,
yes,
it actually removes that. And then my younger brother also confirmed and said, you know what, when I was on the very first period of lockdown 5, I left my fridge actually with food inside, and electricity went down, and he was in the free state, left the flat, which is in Gauteng. When he came back, it was smelly and all that, and he used an onion for that. So it's all those things that came into my head and said, it means this onion has more things actually that it can do for people. And when I listen to these other doctors, there's also another Chinese doctor also who talks about it. So we decided to try it with my wife, because the treatment that we received at the hospital, I must be honest, was not really helping me. I was given a treatment for a pump for asthma, because
I'm just sorry to break your way, but you were actually, were you hospitalized?
I was not hospitalized. I went to the hospital, but I was given treatment, and that I had to go and use at home.
Oh.
And specifically when it comes to breathing, I had difficulty in breathing. It was
Okay.
very difficult for me to breathe, and even for me just to talk, I couldn't talk. Every time when I tried to talk, I would be coughing. I tried to utter a word and I would be coughing. So,
Okay.
and the treatment that was given to me was not really working. And this is just my case. I'm not saying this is the general case. I need that to be understood very clearly. So,
Oppa, can I just
yes.
ask, can I ask Dr. Elrike a question quickly?
Yeah, no, that's fine.
Okay. Dr. Elrike, what is the general treatment for COVID? Is it, do you treat symptoms, or is there one generic, or like how do you go about it? Then I'll get to Tracy and ask her what she did.
Yeah, that's fine.
So, as with any virus, your first line of treatment is basically symptomatic treatment, meaning you want to treat the symptoms. There are antiretrovirals or antivirals that can be used. So, you use antibiotics for bacteria, and antibiotics will not work for a virus. So as you get antibiotics for bacteria, you get antivirals for a virus. And there is one, remdesivir, that's been shown to actually help against the coronavirus. But that is actually really just for the very ill cases, the very ill people that's been admitted to hospital, and that who's really struggling. So the mainstay is basically symptomatic treatment. If you're at home, you need to keep hydrated, need to rest enough, eat healthy food. You can use something like paracetamol or Brufen to keep your fever down or treat any aches and pains. And then whatever else you need, if you want to use ACC for that matter, but it shouldn't be, this COVID doesn't actually really cause a lot of, like a wet cough and a lot of phlegm. It's actually quite a dry thing. So whatever you have that you normally take for normal cold, normal flu, that's what you would take. Hospital is something different. Yeah, and so it depends on your symptoms, etc. But hospital is actually also supportive treatment. So we just try and make your, the work of breathing easier, try to get your oxygen levels up, make sure you keep hydrated, eat healthy, and so forth.
Thank you. Tracy, what did you have any symptoms at all? Did you just use paracetamol? What did you use? Because Oppa's got an interesting story.
Oh, okay. I just used just basic paracetamol, painkillers, because of the headache. That was the main issue. And I rested as much as I could. Yeah. So that was what I did. And obviously I ate regularly and ate healthily, drank lots of fluids.
Yeah.
So it was very simple treatment
Okay,
plan for myself.
Okay. Okay, Oppa, you started there with the onions that I'm used to with obviously painting. But tell us what you found.
Yeah, like I was saying, as I was listening to the guidance from the videos that I watched on YouTube, and seeing all these other doctors, and there's many other people who talk about it. We decided to try it because we had no other thing to use with my wife, and specifically with the breathing problem that we had, because it created something like an asthma attack for me. Sure. So we decided to follow the guidance. So on the video, they clearly say that cut the slices of the onion, and they recommend specifically the red onion. Okay. Because it's the one that is actually much stronger apparently. So we cut the slices, and I put the 3 pieces on my breast.
Yeah.
And then we had others in a bowl on the side. Yeah. And we put a plastic wrap on my breast, but which I discovered that actually was not even the best. Actually, it's best if you use a normal cloth. Okay. Because if you use a normal cloth to cover it, to hold it on your chest, it helps you a lot in opening up your airways, and it makes it easier. It basically stops the difficulty of breathing within 30 minutes. And that is what happened to me. That's what happened to me. It helped me in making sure that I was able to breathe normally, and then I could deal with other issues of coughing which
Yes.
I used other remedies actually to be able actually to reduce that.
Wow. Dr. Elrike,
So-
is there anything particular that you know of that's in onions that could do that? Or is it just, you know, that Oppa had a wonderful finding there with his research?
We know that there's a lot of, or let me put it this way, a lot of Western medicine actually has their origins in what we call the traditional medicines, either the Eastern or African traditional medicines. And we know that a lot of plant-based medicines, etc., actually has certain compounds in that can work. I'm not sure exactly what in the onions work, and we don't always know exactly why something works and how it works. We just know that it does. So no, I don't know exactly what it is, but it's exactly as he said. There's quite, I mean, I'm sure if you go read something like garlic, for example, also quite good antiviral properties, vitamin C. So there's quite a few traditional remedies that do help.
Wow. Chrismari, what kind of support during this time does a patient need for when they have discovered that they've got COVID? Is there anything that we can do? Is there anything that they should be doing to keep their spirits up?
Yes, Monique, I think the isolation for the patients are the worst, because we're not used to isolating ourselves from our families, our children, even our loved ones, and people tend to be very, very lonely. So I think we need to use our social media. We need to be able to phone in on a WhatsApp call or send messages or the video calling, even like we're doing tonight, the Zoom sessions and a Zoom chat with your friends when they're COVID positive would be extremely helpful and supportive, because it's not, for a lot of people, it's very lonely to be in a room alone and to only see someone just push you a plate of food 3 times a day. You're not able to connect with the family. Your kids can't get close to you. It's very, apart from the anxiety that you have and the worry that you have around being COVID positive and what the next day will bring, I think being lonely it's quite traumatic for a lot of the people that's positive.
Thank you. Tracy, how did you deal with you being positive and having a family and having a special needs child? I mean, I know Rain could understand mommy's not well, mommy's in a room and mommy can't be with us, but Erin just, you know, I know that she won't be able to understand. So when she wants a mom and she can walk. What did you do?
So firstly, I want to apologize for any background noise. That could be a kid or something like that.
It's a family time.
So when I actually got the verdict that I was positive, it changed things. I was quite comfortable with the idea of being COVID positive. I knew that, you know, many people are going to get it. But when I was actually told I was COVID positive, it was a very different experience. So firstly, I was looking at my house thinking, okay, so how do I do this? Do I stay in my room and just keep my door closed and can I not go to the kitchen? Can I not do this and this and that? And practically it's very, very difficult. Also because I was pretty asymptomatic and because it is tough looking after kids when you're not well. But it's also tough on the other person. For example, my husband, who's very, very hands-on and very supportive. But it's not really fair on him if I'm asymptomatic and I could be assisting him with doing the odd thing with our kids. So when I had to help out, I made sure I wore a mask and we, you know, kept hygiene protocols in place. But I couldn't just lie in bed for 14 days and have food delivered to my room. It just was not realistic at all. And I was very blessed. No one in my household got COVID. Even Erin's carer, we had her isolate for 8 days. Like at the time, that was the protocol, and then have a test, and she was negative. So during those 8 days, it was just my husband and myself, and then our 2 kids, because the one is not at school. So it's homeschooling, and Erin's like a baby, so it's nappies, it's feeding, it's the whole 2D. So yeah, but I felt that, I did what I could. I did the best I could under the circumstances. I knew that there was a risk involved, and with that, we decided to isolate as a family, so that we could just do what we needed to do. Yeah, and I really feel like we were blessed in that it didn't get worse. With all our plans to immigrate and all that, it would have made things a lot more challenging. So I'm very thankful for that. Yeah.
Thanks. I want to find out how Oppa handled this, but just quickly, I want to ask Dr. Elrike. Dr. Elrike, once you find out there's something called, is there a contact list? What do we do? How do we know what is what? You tell us.
So one of the ways that that the world is trying to tackle this virus is to keep it from spreading. That's obviously and to keep it from spreading, you need to make sure who has been exposed, who has it. So when someone gets diagnosed, they have to have a contact list. So you either are a high risk or a low risk contact. A high risk contact is someone who's been in contact with the person that's infected in the previous 2 days. It changed recently. It used to be 7 days. Now it's just the 2 days before you got diagnosed or before you started symptoms. So high risk contact, if you've been in contact with that person less than a meter from them for longer than 15 minutes at a time, and you weren't wearing masks, you or the other person. So that is a high risk contact. So that means that you are high risk to actually get the virus. So high risk contacts, they need to self-isolate at home. And for example, not come into work, not go to the shops. Self-isolation really means that you really need to be in your house and not in contact with people out there. Low risk contacts are someone who, for example, have been in your facility, but I mean, you haven't been in that close contact. So earlier we used to also send low risk contacts home. Now we don't do that anymore. We actually just monitor them at work or wherever and see if they develop symptoms. But this is one of the mainstays of of trying to contain this virus, is the contact tracing.
Okay, so you can actually, that's quite amazing that you can actually carry on unless you show symptoms, and it's 2 days. Wow, that's really, I remember it was 7. I didn't even know it changed to 2.
Yeah,
Oppa,
it's
Oppa, tell us about your story. How were you able to isolate with your kids and your wife, and how did you feel during this time? What did you do?
No, my kids are adult kids. They are 20 and 24.
Oh my goodness, okay.
Yes, and like I said at the beginning, when I discovered I was sick, I was actually taking my youngest one back to school, and my son was going back to Johannesburg. So it was just me and my wife. So my wife is the one actually who was the pillar for me, because I got very, very sick. I couldn't stand up and walk. I was sweating. So she had to help me with the changing of clothing and everything, because my clothes had to be changed about twice or thrice actually a day, because
Wow.
of the situation I was in. Yes. But I have a big house, and it's a double story. So I had enough space for me to play around just where I was in, and I've got another private lounge also on top, so I could actually live on that space by myself. And the only person who was exposed was my wife, who was exposed to me. But when we talked to the doctor, and I recommended that my wife has to go and be tested, he already said there's big chance that your wife is already positive. So rather just stay on treatment, the two of you. So she wasn't sick. I would probably say that she was asymptomatic, but she wasn't actually showing any signs. She started coughing a little bit, but then stopped. but
Okay.
we literally made sure that we are not in contact with other people. It was just ourselves in this house, and she's the one who was going down, cooking, bringing the food and all that. And that's basically how I managed. But I must say that during the second week, the isolation got to me. I literally, I can say I was kind of falling into a depression kind of a situation.
Yeah.
And the support of the family, because we were always talking with the family on WhatsApp group, and they were always talking to me there, because I couldn't even talk over the phone. Because of my throat. It was even I basically lost my voice.
Sure.
So the support that I had with the family, talking to me from Free State and Gauteng and here in the Western Cape through the WhatsApp group, that kept me going. And I tried by all means, also as a Christian myself, I tried to feed myself a lot with listening to the preachings on TV. Fortunately, I've got an Android TV in my room, so I could actually I was literally, my wife was even saying, you were on the Bible almost right throughout. So basically, I tried to boost myself and encourage myself. Yes. And saying also, because one of the messages that my mother said to me just before I got west, he said, my son, I'm praying for you, but you have to pray for yourself as well. Yes. So that was things actually that kept me going during that period. But I must say, during the second week, I really crumbled and went down. I was crying literally, and it was a very difficult situation. So it brings that situation to you where, especially with me being diabetic, I was afraid because of diabetes. And there's a lot of preaching or messages saying that if you're diabetic, you're already on the way. So I think those things got to my head as well.
Yes.
But I managed.
I want to ask Dr. Elrike a question quickly. And then I want to go back to what word you stood on during that time. But Dr. Elrike, those, he mentioned he's got diabetes. What are those called comorbidities? And what are those things that we need to be more wary of? What conditions we need to be more wary of if we are, trying to stay safe?
Yeah, it's been shown, or this virus has been shown to more target certain people a bit more severely, or affect certain people more severely. So let's just start at the beginning. Most people who get this virus, and we're talking about more than 80%, will actually either be asymptomatic or will have like very, very mild disease, very mild symptoms. It's a very small, it's like 15% of people who might need hospitalization, and of those, it's even a smaller percentage who would need to go on and be ventilated, and of those, it's still a small percentage who would pass away from it. So we know there's certain risk categories or people that's more at risk, and that is typically your elderly, people with, and it's usually uncontrolled diabetes and hypertension. And obesity is actually the one factor that came out very, very strongly. And it's because obesity is actually a pro-inflammatory condition. It causes it causes a lot of effects in your body. So obesity has been one of the factors that's actually been shown with quite a strong correlation to having to be intubated and ventilated and to passing away. So yes, that's those comorbidities make your risk higher to get this disease very severely and to need hospitalization plus minus ventilation.
And like I said to you earlier on, I needed to debunk something for me because I don't know, how this disease spreads. People say, my colleague was telling me the other day that it's airborne. I instinctively, and I know it's so stupid, I walk past someone that's in my personal bubble and I just hold my breath and I walk past as quickly as possible. And I know that it's silly, but just tell us how is this disease spread or illness spread, and what do we do to keep ourselves safe? And then Chrismari, you can tell us what we do to keep ourselves psychologically safe, because I can tell you my anxiety levels at the moment are a bit high.
Yeah, yours and about, I think, the rest of the Earth's population. So I first want to start with, if you think it's silly, but it works for you, it's not silly. So if that's something that makes you feel safe and secure, then, you do that. So this disease is spread by droplets. So droplets are heavy. There's a difference between it being airborne and it being droplet spread. So airborne means it's carried on aerosols. So it's very small droplets, and that's usually when we, for example, intubate someone, or we suction someone, or we do certain procedures. So that causes aerolization of your of your body fluids, and with that the virus can actually spread quite far. More often than not, people who work or walk around you in contact with you, that is droplet spread. Droplets are when we talk or when we sneeze or cough, and droplets usually sort of fall flat about a meter from you. So that the biggest risk actually is not if someone walks past you, it is if someone was in the shop, or they was at the counter before you and they sneezed, or they coughed or something, and some of the droplets fell on that surface, and you touch the surface. And then you, for example, touch your eyes, your mouth, or you adjust your mask, etc. That is when it actually gets that's the most common way of spreading. And that is why simple stuff like hand hygiene, just washing your hands or using the hand sanitizer is actually one of the biggest things you can do to keep yourself safe. Because it's because of touching surfaces where the droplets have landed and then touching yourself that's causing the biggest risk.
Thank you. Chrismari, as Oppa mentioned, most of us nowadays, many people throughout the world, this pandemic has brought most people to the Lord. Honestly, we are all reading the Bible, we are standing on the word, and that is how we're encouraging ourselves most times daily. How do we keep ourselves psychologically safe during this time? Our emotions are all over the place. Some people that have not been so antsy or more antsy. What do you suggest for us going forward now that we're in lockdown, 3?
I can't remember. I know it's 100 and something days. Monique, I think one of the biggest things that people should be careful of is social media. I know we on social media at the moment, but people must please just detox themselves from what they read and what they're looking at, because we are anxious and worried about the COVID and the impact that it's got. We are reading a lot and we're following a lot of pages or news articles about the deaths, and people are just writing about how bad it is and how bad the people, but there's a lot of positive that also comes from all of this. There's a lot of us that's been able to work from home and been able to isolate in our houses and spend more time with our families. It's the first time in 15 years of marriage that I've seen my husband for so long, because he's been in the house for 4 months now without leaving. So there's a lot of positive also in all of this. So one needs to take control of what you expose yourself to. And religion is extremely important. No matter what your beliefs are, I think we all need to know that someone's covering for us, and that someone's got our back, and we're going to be fine. We just need to trust the process. And then also, if you've been diagnosed with any psychiatric disorder and taking medication, one needs to take extra care. Make sure that you take your medication. All our psychologists, as well as the doctors, do provide Zoom consultations. I know SAISA, the Psychological Association of South Africa, has got a whole database of psychologists that provides a free service to people, and it's an online service, yes. So that's also something that you need to tap into. There's a lot of psychologists that now provide trauma counseling or counseling online, and if you're not coping, you need to tap into those resources. And make sure that you get the appropriate support, because this is difficult times. It's putting a lot of strain on people, and it's putting a lot of strain on their families, and we need to support each other. And don't treat your friends or your colleagues that you find out is COVID positive like someone that's got some or other, I know they've got something, a contagious disease, but they need your support now, and we need to be there for one another, and help each other.
Yeah, we need to practice understanding. But there's that stigma again that I've been seeing all over social media as well, which is also making me want to see less of social media, because
Yes.
my husband says people will judge either way. But at this time, we're actually trying to get people to be more understanding and more graceful.
Yes.
Oppa and Tracy, I'm going to ask Oppa first. What word did you stand on during that time while you thought you were while you were actually going through the worst, and now you're looking your best?
Definitely is. Yeah. Firstly, it was Psalm 23. If you go through it, it basically tells you that if you have faith in God, God is there for you, and He will carry you right throughout, no matter what the situation may be. I think that's where my faith actually came. And the other thing again that I was also doing, I was listening a lot to gospel music, because in gospel music there's a lot of messages that you get. And one of them was the song by Jen Johnson, Goodness of God. And that actually encouraged me a lot to say all of my life, because if you listen to the song actually says that all of my life God has been good to me. So the question I was asking myself was, why now? Why should now God leave me when I need Him more? And that is something that one of the songs that encouraged me. The other song that encouraged me was a song by Grace Lasson. Grace Lasson's song that says, I know the man who can. And it was this song actually that said, no matter the situation I find myself in, I know that my God actually is there. And I know that Jesus is there to help me and to make sure that, and I believed it. I believed that I would wake up. I never saw myself as dead. I saw myself, no matter the situation, no matter the depression I went through, I saw myself walking out again, because I always said, I've got a daughter that I have there. And I said to God, God, I have this girl who's doing her second year now and at tertiary. I must be at her graduation. It is those things that I encouraged myself with, but also one book in the Bible, the book of Job. It tells us about the suffering, the losses that Job went through. But because of his faith in God, he managed to get out through all that, all the losses. Yes, he lost his children through death and all that, but he managed to recoup all his wealth and everything, became even much more wealthier than before. Those are the things actually that kept me going.
Wow. That you are a true warrior.
No, thank you.
So, Chrismari, so that type of feeding your soul, visualization, that does work. That how do we incorporate that in our daily tasks, though? If you know, some of us are so busy and we wrapped up in this ball of anxiety. How can we incorporate in our daily tasks? How do we do that?
Monique, I think it's about scheduling time for it and making time for it. There's so many apps that you can download on your phone, on social media these days, that you can just do that mindfulness. It's absolutely amazing to just stop and be in the moment, and to reflect on how are you feeling and how are you doing and where are you going with this. And there's the most amazing things that you can download for free on the App Store, that you can just take yourself through a visualization, and even with breathing techniques, that you can just literally lower your heart rate, especially if you're someone that suffers from anxiety. You can see how your heart rate drops when you do those follow those techniques. So there's a definite place for that, and I think that's the way to start before you go to a doctor for medication and something else. I think that's obviously, I like what you're suggesting there. Yes.
Okay, thank you. Tracy, what did you do to motivate yourself and get yourself through that time while you was were not feeling well. I know that you are part of a wonderful WhatsApp group where you have encouragement. It's Spirit Sisters, where you know your sisters in Christ are there and they give encouraging words. Was there anything in particular that you stood on? Any word in particular that got you through?
Hi there. Well, I wouldn't say there was any word, any verse from biblically, but it was a strange time because I was resigning. I had resigned, and I got COVID 14 days before my last day at work. And there was the immigrate, you know, us trying to, you know, get things sold in our home and all that. So there was a lot happening, and also our daughter with special needs, Erin, she was acting up quite a bit. It wasn't the easiest time with, you know, how she was feeling and that type of thing. So in a strange way, I found that being diagnosed with COVID was a blessing for me, because I had to really just stop and, you know, pull myself towards myself, get perspective on things. I felt like God was speaking words of peace and clarity into my spirit, and just feeling like, you know, everything's going to be okay. And it's like he said, he wanted me to stop and just be still and, you know, spend time with him and be closer to my family. And it just helped me reprioritize things. Yeah, so for me, it was really, really that. And you know, in life, I'm sure we all can say this, but I just feel like life does throw you curveballs. So I don't expect the future whether I'm not going to get any other curveballs thrown at me. And that is just the way life is. But just really pushing into the word and just praying and knowing that God is walking this life with you.
Yeah.
That's what makes the biggest difference of all. And that's what helps me go on in life, because there are some days, obviously, when things are just too much. But you just have to have faith that that this will pass. Again, I'm very thankful that I didn't have symptoms. It must have been really hard for you, Oppa, to go through what you went through. But I can see that God also spiritually did things in your life during that very challenging time. So yes, I do like to see the positive in these situations. And for me, I definitely, it was like I needed that time to just be still and get my head right for what's coming.
Yeah, it's been a season of reevaluation for many people. Dr. Elrike, I want to ask you something about this pandemic and where it's heading. I hear things about the curve. I hear things about, you know, it's only going to get worse. We would love to believe that it's over now and it's just going to go back to where it came from. Tell us, where are we going here? Are we at that curve? Are there trials currently happening?
I cannot tell you where we are going. I don't think anyone knows. There's obviously lots of mathematical models. We can work on information, and we can only work on information that we have. So information that we, for example, have from Italy and from the USA and from China. And we can sort of use that. So we use stuff like, for example, doubling time. So how long does it take for the virus to double in numbers? We can use stuff like what we know about the incubation period. But I mean, this is a very new virus, and we actually know relatively little about it. So we can have models, and we can say, yes, just in the past few months, I mean, we've had so many predictions. You know, first we would have had our peak like in April, and then it was July, then it was August, then September. Now it's, you know, no, it's earlier. Now we're not going to see that big peak. It's impossible to really say. And it, as we also can see in our country, just the way the different provinces actually react to the virus makes a massive difference in how the virus spreads and reacts in that province. There are a lot of trials happening. throughout the world, and they're not always going through the normal pathways, because obviously we want to expedite the results. So there's an interesting website where all these like trials before they get published, where they are. So you can go have a look. There's literally like hundreds, almost thousands, I want to say. But what you also must remember is we don't have long-term data. So everything that we learn now is usually smaller numbers, and it's a short period of time. We know very little, and at the moment we really just have to, I think, believe and sort of go with the flow, do our best to try and prevent the spread. But yeah, we must see where it goes. I don't have an answer for that.
Okay, thank you. Chrismari, both Oppa and Tracy mentioned that it was a time for them to take stock, trying to kind of just look at what was really important, engage with those people that are important. How would you recommend we can kind of do that for ourselves? How would we, during this time, take stock of what is important? Do we like do a gratitude list, or, what did we do?
Monique, it depends on what works for you. For some people, it is very helpful to start doing an attitude of gratitude or gratitude journal. For other people, it would be to just literally, it depends also on your personality. For other people, it would be easier to connect to people that they feel that they need to say thank you to, or talk to them and to engage with other people. But yes, you are forced to slow down. You're forced to sit, and you're forced to think a lot, because you don't have your daily routine. You in your house with your loved ones, and I think it's somehow, for me, this whole pandemic has got somehow also a positive spin on it with regards to that specifically. Because for the first time in a very long time, I've been able to connect with my family, because the rat race out there is slower. So it's actually forcing all of us to go slower. All the cultural activities, the social activities, we are all, depending on, irrespective of whether you're positive or not, we are all forced to be at home and not go out, and the curfew being back between 9 and in the evenings. We are all forced to go slower and to stay at home. And I think it's a good thing somehow for us emotionally. There's no competition out there. We all, it's a level playground for everyone. So it's time for us to reflect, and it's time to have a look at what we are grateful for and what we've got.
Yeah, thank you. So guys, let me encourage you there. Just call a friend if you haven't in a while and you've been missing them. Tell them you miss them, and tell them you love them. There are only a few minutes left still, so I want to encourage you, if you've got questions for Oppa, Tracy, Chrismari, Dr.Elrike, please send them through. There is one question from a lady by the name of Inga Stoffels. She'd like to know, what did you say to people who might be scared to take the test? Scared of the process and scared of the outcome. So I'm not going to ask Oppa and Tracy now how they were tested, but I'm going to ask Dr. Elrike, what would you say to those people who are scared to take the test?
I can understand why. Sometimes it's easier to just not know and pretend it's not there. The problem is it's not going to go away. Yes, the test itself is very unpleasant. I'm not even going to try and sugarcoat it. It's not the most fun you can have with 5 minutes of your day. But that's almost the worst. And I always think you are stronger if you have all the information. Then you know actually what you're fighting. If you don't know, you don't really know what you are dealing with. So it's not, I don't want to say it's not that big a deal, because it can be, but it is what it is. There is this pandemic. Yes, it spreads like wildfire. Yes, people get really ill. Yes, people die. chances are you will not be one of those people. I mean, your chance to actually either not have symptoms or recover completely is much higher than you being one of the people who become really ill and end up in hospital. And you just empower yourself if you have knowledge, and to sort of enable you to protect yourself and to protect others. So that's what I would say. I think just knowledge is power, huh?
Yeah, we can't be like ostriches and put our head in the sand, eh, Chrismari? Okay, Oppa, tell us a little bit more about how long you took to get better, because I know there's different, there's different lengths. And
Yeah.
how long did it take for you to get better and fully look the way you look now? Because you look good.
Yeah, no, thank you. For me, I think it took me about 12 days because I was supposed to come out of quarantine on the 22nd of June.
Yeah.
And on the 20th of June, that's the day when I walked out completely out of the house for the first time. And at that time, the quarantine was not yet finished altogether, but because it was safe for me to walk out, I felt much better at that time, and I could actually breathe the outside air for the first time after a very long time. So it took about 12 days, if I can say so.
Okay. Dr.Elrike, is that kind of normal? Or do we just, there's no 12 days, 2 weeks, is it person to person? What's a general sick period?
Yeah, it's usually the first few days is the worst, and I'm talking about the first like 5 to 7 days. That's when people sort of have very hectic headaches or fevers, just generally don't feel well. You can for actually quite a while after that still have, especially if you, for example, are an asthmatic, for a while after that you can still cough, still have tight chest. A lot of people say that they have this tiredness, this fatigue for quite a while, and I'm talking a month, 6 weeks, 2 months after the virus.
Wow.
So it's not something that's you have it and 5 days later you are fine. You must give yourself time to actually recover, and it's very important not to be impatient with yourself, not to sort of get up and going quicker than your body allows you. So this really is a time for you to listen to your body. If your body tells you, listen, you should still be in bed and rest, then you should be in bed and rest. That really is just the best you can do. But symptoms can actually last for a long time.
That's just, I think it's that it's not that cut and dry that has got everybody in the test, because you just don't know what your body's going to react like.
Yeah, exactly.
There's another question from a Simone Amy McKinnell. If one does not show symptoms at day 2, is the test needed if you were in contact with someone, or do you just need to isolate? I think you answered that, but let's answer that again, doctor.
Yeah, so we must remember when you were in contact with someone, we must remember what we call the incubation period of the virus. So that is how long the virus takes to basically take a hold of your body and start showing symptoms. So it can be anything to 14 days, but sort of the average time is about 5 days. So if you were in contact with someone, if you were a high-risk contact, you should go and test on day 8, definitely not day 2, because that is too early, and your risk to actually have a false negative is very high. And then you have this very false reassurance that I'm negative, I don't have the virus, and you go out and infect other people and just get so much more ill. So if you were in contact with someone, I would suggest you wait at least a week, 7 days, and test on day 8, even if you don't have symptoms. At the moment, because there's a shortage of tests in the world globally, not just in South Africa, the case definitions and who they test sort of changes. So at the moment, they, for example, won't test you if you are, you have no symptoms and you weren't in contact with someone, but you still will get tested if you have no symptoms and you were a high-risk contact of someone. But you should only test after 7 days, not before then.
Thank you, doctor. I think we've got about 5 minutes left, so I'm thinking that we can just wrap up and maybe everybody just, Oppa, you give an encouraging word to someone who's feeling fearful, who doesn't know what lies ahead. And then Tracy, and we can, Chrismari can give us something to do with our emotional well-being, and Dr. Elrike, just remind us of 3 salient points that we need to do.
That's fine. From my side, basically, I can say the first thing that we need to accept that there's a possibility that anyone can be affected by this. Anyone can contract it. Never have a situation where you believe that, no, it's not going to affect me, because there's a lot of people actually who are in that space who don't believe that they won't get it. Anyone can get it. And secondly, when you get it, I think you need to have faith in yourself and believe that you will be able to walk out. Because if you have faith that you will be able to walk up, you approach the treatment from the calm point of view. And you will be more able to focus on what you have to do for you to be able to handle the situation. And that's basically the number one thing that I would say that one has to do. Just have faith and believe that you can walk throughout and know that you can get it. Those 2 things, I don't think that anyone can run away from them.
Yes. Yeah, those myths going around that it's a rich people problem and it's everyone. It's like Chrismari said, it's a level playing field. Everyone is at risk. Thank you for reminding us to have faith like a mustard seed, Oppa. Tracy?
So opposites of faith is fear, as we know, and I think a lot of people are scared of contracting COVID. I know it's easier said than done, but it doesn't really help to be fearful of contracting it, because you're really putting your mind into things that are not helpful at all, and the chances of you getting it are relatively high because it's such a mysterious disease. So I think it's important to just try and, I know it's easier said than done, but I don't know, for some people it's harder than others, but to just stop being fearful about it, because if you get it, what's the worst that's going to happen? Obviously we know what's the worst that's going to happen, but you can't just live your life in fear. God doesn't want that for us at all. I also think it's important for people out there that are perhaps single parents or have a home full of people that they are providing for and caring for, that yes, you can get COVID, but you can only do the best you can do under the circumstances. It's not realistic for everyone to self-isolate for 14 days, and everyone's life is different and has its own challenges. And I think it's important for people, especially mothers, because mothers can't be sick. It's not allowed for you. You know what I mean, if you're a mom. If you're sick, you have to do the best you can. You have to look after yourself, but it doesn't necessarily mean, and forgive me if I'm clinically incorrect here, but it doesn't mean that you have to lock yourself behind closed doors, because that will just add to your anxiety and worry, and that's also not good for your health. So you must just do the best you can, and don't feel guilty if you're not following protocols, or if you do have to lie in bed because you are not well, like Oppa was. You have to lie in bed and get well. You owe that to yourself and to your family. I think those are very important things to be mindful of.
Thank you, Tracy. Chrismari, what can you tell us going forward? How can we just, like Tracy says, not be fearful? Because there are days, I will tell you, I am super fearful, and I'm trying to not be, and I'm standing on the word, and I'm trying not to be anxious. But there are days when that happens. What do we do? Do we just like face that and go, okay, today I'm feeling a little bit fearful, but tomorrow I'm going to be at peace?
Monique, I have to say it's in our most challenging seasons that actually serves as our greatest teachers these days. So our thoughts actually determines how you feel emotionally and also what you do and how you behave. So please keep track of what you're thinking. I think we need to be wary of thinking and over exaggerating it maybe, or being over dramatic about it and being too scared. What you think and how you think about it will determine whether you cope or not cope. So keep track of your thoughts, please. And if you struggle, tap in with a friend, tap in with someone that's been through this, that can alleviate your stress and tell you that it's actually okay and you're going to be okay. Then you will immediately start feeling better and cope better. And when you've got family members, and I know there's a lot of people that lose loved ones due to this COVID, and that is absolutely traumatic, but we cannot control the things that's not in our control. The only things that we can control is the stuff that we have control over. And we need to try and remember that. And we can control what we do and how we react to this. We cannot control this pandemic, but we can control how we cope and how we think about it. And that is the most important thing for me as a psychologist, and the best tip to give to the people out there.
Thank you, Chrismari. Dr.Elrike, 3 salient points from you for us to just remember going forward.
So I want to actually also agree with what Tracy, what actually everyone else said. We must remember this is a pandemic for a reason. This is a extremely clever, very sneaky virus. So sometimes even despite all your best efforts and you're doing everything right, you might actually still get it. So for myself, one of the big things is to sort of make peace with the fact that it's with us now. So keep